Hello, everybody. I'm Sakher AlQahtani from King Saud University. Um, this lecture, I will go through a little bit of age and human rights, how it affects the human rights. And then we'll talk a little bit about the importance of age, and then with the history of dental age estimation. And then we're going to talk more about the London Atlas. Well, as you know, I come from Saudi Arabia, and when people think of Saudi Arabia, many people think it's, think of the desert or Mecca. So both of these images of Saudi Arabia are correct, of course, but at the same time, Saudi Arabia is more than that. It's a cosmopolitan area with lots of historical sites and green and mountains. This is my village in the south of Saudi Arabia. It's very green when they think of Saudi Arabia. Recently, my country has gone through a lot of changes in the past couple of years. We opened the cinema for the first time, and women started to go to football stadiums. They were allowed to, and also driving for women started. So this is a huge change in the identity of our society. And societies can go through that. They can change the identity. But is it important to have an identity for a person or an individual identity? Having a legal identity is a fundamental human. Sorry about that. When did you lose me? Hello? Can you hear me?
Yes, we can hear you.
When did you lose me?
It's about a minute ago.
Okay. So as I said, in Saudi Arabia, we're going through a lot of changes. We opened the cinema recently, and women were allowed to go to stadiums, and women were allowed to drive. So the society of Saudi Arabia is going through a huge change of their identity. So as important as it is for societies to have an identity, also individuals' identity is very important. Having a legal identity is a fundamental human right that enables access to other important rights, benefits, and services. Goes with us from birth to school, marriage, retirement, and death, and even after death, having the identity.
I'm sorry, Dr. Sakher, for interrupting you, but
yeah?
we can see your PowerPoint.
Sorry.
It's okay. Okay.
Now it's good?
It's good. Thank you.
Yeah, so even to death and after death, having an identity is very important. And the right to a personal identity begins with the right to life. The Universal Declaration of Human Rights, created in 1948 to preserve the biological and philosophical elements of human beings. Developments towards the protection of personal identity through avenues that manifest identity, like private life, expression rights, personality rights, and the right to know your biological origin. The UN Convention on the Rights of the Child stresses the value and importance of a child's identity. The identity can be either static, which is attributes that make one visible to the outside world, like physical features, sex, name, genetics, and nationality, or it can be dynamic, which are the morals, the religious, and cultural characteristics. Under Article 7 of the Convention of the Right of the child has a right to have a legal identity by being registered and has a right to a name and a nationality. And these are the static aspects of the identity. And Article 8 protects and encourages the child's dynamic aspects of identity through preserving his or her identity in relation to nationality, name, and family relations. And it is the state's duty to protect these rights both passively and actively. These articles were put to protect children in conflict areas and in disappearing cases of children. The Convention on the Rights of the Child is the most ratified convention in history. It was started in 1952, and then it was signed in the late, or agreed upon in the late 80s. 30 years have gone through countries to go through all the articles and correct them and shape them into what it is now. 193 countries of the UN have signed the Convention of the Rights of the Child, except for 3 countries, the United States of America, Somalia, and South Sudan. So under this convention, the parents have the duty to declare the name, the surname, and the date of birth of a newborn to authorities in charge. And by this recording, the state officially recognizes the existence of the child and formalizes their status in the eyes of the law. So it is shocking to know that there are still 40% of births are unregistered in developed countries and 50% of births are unregistered in developing countries. It's a huge percentage, which is in violation of human rights. This is a map of the UNICEF where the birth registrations happen. The countries in red are the least of registrations of birth, and the green ones are the most registration. And by a simple look of this map, you can see that most people who are forced to flee their countries or they are trying to be refugees or immigrants come from countries that are low in birth registrations to begin with, so they lack the documents in the first place. And the child without an identity will be invisible in eyes of society and will not benefit from protection and social services essential to their development. And lots of organizations take advantage of that. This has major implications for criminal prosecutions of people suspected of recruiting child soldiers and those accused of sexual offenses against children. So it is important to have the legal document showing your age, because of if someone is involved in a crime and they are a child, we need to know their age so that we can prosecute them properly according to their age. The age of criminal responsibility, children under this age cannot be arrested or charged with a crime. And the UN published guidelines to the effect that no children under the legal age of criminal responsibility should be subject to criminal charges, and is openly critical of nations with an age of criminal responsibility of 12 years or younger. Further to this, the UN suggests that the nations independently and objectively ascertain the age of child within their jurisdiction whose age is not definitely known, as would be the case for trafficked children. The age of criminal responsibility differs from one country to one country, so it is important for anyone who works with age estimation to know the age of criminal responsibility in their country. And some countries even have different age of criminal responsibilities within their countries, like the United States of America. It can be in some states, they don't have a minimum age, and it can be up to the age of 21, like in Switzerland. By the look of this, the legal age in Indonesia, it could be between 6 and 9. The age of criminal responsibility in Saudi Arabia is 7 years old. Falsify their age, either by for child marriages, when someone wants to sell their daughter to marriage, as they say, they put it. They falsify the age so that they can be legally married, or to enroll them into child soldier, to being in an army. And sometimes this falsification of age happens on a state level. This is the Chinese gymnastic team that competed in the Olympics in China, and they got the gold medals, but their ages were falsified to be younger than what they are, so that they could compete within a different age group. And then when it was found out, the gold medals were taken from them and given to the second winners, who was the Canadian team. So the ratification by all but 2 countries globally has cemented the significance of age by creating the first international definition of the child as any person below the age of 18 years. So anyone below the age of 18 years is considered a child. Therefore, they have to be granted asylum automatically if they were to seek it. Any country who signed the Convention on the Rights of the Child is responsible for that person to give them health, safety, education, regardless of where they come from. And this is the problem, because now we live in the biggest crisis in recorded history, with the amount of people needing to flee their countries. Half of them are women and children, and the problem is that the countries are responsible for the children who need to flee. This is the net migration rate for 2016. The countries in orange have more people going out than in. The countries in blue have more people going in than out. And the countries in green have the same amount of people going in and out. But this is the picture of 2016. This hasn't been the same story during history. In the past, it was the opposite picture. There were 480 million Europeans immigrated from Europe at some point in history. That is 6.5% of the world population. And between 1815 and 1932 AD, 60 million people left Europe because of wars, famine, and etc. So they were refugees at one point, and they were immigrants. So the immigration crisis is a huge, huge problem that I think history will judge us harshly for in the future. Now there are 65.6 million people forced out of their country. If we put this number into perspective, it is 33,000 people a day that are forced to go out of their countries, not by choice. 22.5 of them are registered refugees, and the rest are illegal to be on Earth. So they are between countries. There are 10 million people who are stateless, so they don't even have a country to go back to. And out of these numbers, only 189,000 have been resettled. And this is a huge problem. There are millions of people illegal to be on Earth, and they live in miserable situations. So for example, in 2017, in the first 10 months of that year, almost 328,000 had crossed the Mediterranean, to reach European shores, compared to 736,000 during the same period in 2015. And despite the increased capacity for search and rescue operations in the Mediterranean and numerous governmental organizations conducting rescue missions, by mid-November, 4,271 had died or gone missing at sea, making 2016 the deadliest year on record. And I can imagine that Indonesia, you have the same problem for refugees trying to get into Indonesia through the sea. And in 2016, for an example, the substantial majority of unaccompanied minors were males. Over 2/3 were aged 16 to 17, while those aged 14 to 15 accounted for 21%. More than a third of them, of asylum applicants considered to be unaccompanied minors in the EU, were Afghans, and about a fifth were from Syria. So age assessment is very important because the hosting country wants to make sure that this person who claims to be a minor is in fact a minor, because they have to provide them with resources, they have to provide them with safety, health, etc. And so it's a huge human rights issue for the minor to prove that they are minor, therefore deserve asylum, and for the hosting country to make sure that this is in fact a minor who deserves asylum. So they resort to age assessment because when they lack documents or if they are not sure that the documents are correct. So the age assessment is a procedure organized by a public body to determine the chronological age of an individual lacking these legal documents. Unaccompanied minors is a huge issue. There in the EU or the European Union, the people who are coming over, there are 8 out of 10 children are unaccompanied, so they are alone. So assessing the age correctly is a fundamental human right. And an age assessment is a procedure organized by a public body, as I said, to determine the chronological age. And while doing that, we have to remember that there are some rules or pillars to protect the rights of the minors when age assessment is done. The first one is the best interest of the child has to be the rule. It is an interpretative legal principle and the rule of procedure within any decision-making process of member states that have ratified the UN Convention on the Rights of the Child. It's to ensure the highest degree of protection of the rights of the child during age assessment. It is necessary to approach every step from the perspective of the best interests of the child, including his or her own particular circumstances. They must be a primary concern and even over the state's political interests. The second rule is the benefit of the doubt with the presumption of minority. If there is a chance that the individual is a child, he or she should be treated as such. And the decision to deny international protection should not be based solely on the child's refusal to undergo a medical examination. If doubts remain once the results of the tests are known and margins of error are taken into account, then the minority of the child should be presumed. The third rule is to have an informed consent. Prior to the undertaking of an age assessment, the child and his or her representative should be informed of the procedure awaiting the child, its risks, and the consequences that may arise from the conclusion or a refusal to proceed in a language and a way that the child and his or her representative can understand. The fourth rule is to use the least invasive method. And that is to ensure the highest level of protection of one's dignity when undergoing a medical examination. The least invasive and intrusive method should be used. The first step should be to consider all evidence available before having recourse to a medical assessment. Intrusive methods should be used as a last resort only. And there are some challenges throughout the process of estimating the age or assessing the age of minors. An appeal or judicial review should always be available if the age assessment was not satisfactory to the person or the minor. They should have the ability to appeal that decision, and they need to be provided with legal advice in a language that they can understand, with explanations regarding the reason for the decision and their possibility for appeal. So age is a fundamental thing to protect the rights of the minors, and it's a crucial part of a person's identity. Why do we need it? In the living, it tells us when a person can go to school, when we are allowed to get married, when we get pension, the legal responsibility, the age of consent. And in the dead, it helps us to identify the body if it is unknown. And for legal issues and information, it gives us information about past populations. It is very difficult to assess the age of a person by just looking at them. The vampires are so glamorous and beautiful, and they are hundreds of years old. And I thought I was glamorous and beautiful until I turned 40 a couple of years ago, and my daughter made me a birthday card saying "You are ancient" on it. And there goes my ego. It was a hit to the to the system. But this is how she sees me. So assessing the age by looking at person is very subjective. That's why we need objective methods to do that. For us to do age estimation, we relate chronological age to biological age using known specific maturating events. And for that, we select a feature of the developing individual that grows or matures over a long period of time, that has measurable stages that we can identify. And these stages has to happen over a short period of time to give us the sensitivity needed for age estimation. This feature or system in the human body has to be stable and survive inhumation well in case we need to do it on skeletal remains. So there are different systems that can be used for age estimation, from biological maturity, emotional maturity, the social status, educational progress, and chronological age. And basis for life decisions, we base it on the chronological age, which is best used with adjunct data. So I'm going to talk a little bit about techniques of age estimation. There are, it can be psychological, can be anthropological, using bones, dental, or histological and biochemical. It can be divided into techniques that can be used on sub-adults or adults, or it can be also divided in techniques that can be used in the living or in the dead. Teeth are very important for age estimation. They develop over a long span of the human life, covering a third mostly of the human life, and even after they mature, the post-developmental changes can also be used for age estimation. They have measurable developmental stages that happen over a short period of time. They are unique to the individual. And there's a continuous process of formation. So from the cusp tip to the crown to the development of the roots until the root apex, the tooth goes through all these stages like a clock. So when it starts, it goes regardless of nutrition, regardless of disease. It takes the same amount of time when the clock starts to develop. Tooth development is a dynamic process. We have two sets of teeth, deciduous and permanent, and there's eruption and shedding, and so it's a dynamic process. They survive inhumation very well. This is a set of 47 human teeth found in China, and they are 80,000 years old, perhaps even older. The rest of the body has been, it's not there anymore, but the teeth have survived very well. So when we have the dental age, when we estimate the dental age, we can predict the chronological age. So the dental age is the physiological age. which is the age best associated with a developmental stage in a normal reference population. In subadults or children, we can use eruption and emergence of teeth, tooth formation, and this has a narrower age range, whereas in adults, we rely on post-developmental changes, and that gives us a broader age range because it is affected by environmental and habitual factors. So there are various methods that are utilized to determine the age from the dentition. These may be described in four categories, namely clinical, radiographical, histological, and the physical and chemical analysis of teeth. One of the simple methods of age assessment is the clinical or visual method, which is a visual observation of the stage of eruption of the teeth. It can give an approximate estimate of age. And the history of that was the use of tooth eruption or emergence as a tool for estimating the age of children became the standard method due to the ease with which it could be applied, requiring only a simple intraoral examination to gather the appropriate data. It was recognized that there was some variability in the emergence of teeth between individuals, and consequently, as the method matured with time, the concept of age ranges was developed to cater for this variability. The overwhelming majority of the early studies focused on the emergence of the teeth through the gingiva, as opposed to the chronological timing of the development of the dental structures themselves. With the work published by Legros and Magatot in 1880 being a notable exception. This research involved the dissection and examination of human cadaveric material taken from both children and adults, and resulted in the production of a tooth formation table that was shown in almost unchanged form in the literature up until the 1930s. Studying eruption of teeth is a somewhat misleading method for age determination, as the moment a tooth emerges into the oral cavity is a fleeting incident that will, in all probability, never be observed. So tooth eruption may also be delayed or advanced by external environmental influences, such as dental caries, systemic illness, premature loss of deciduous teeth, and crowding. These are tables from my papers of alveolar eruption. My data, when I gathered the data, I looked at alveolar eruption, and these two tables give you the information needed for each tooth and their alveolar eruption. I also added to the table the time of the clinical emergence from different papers. For deciduous teeth, it's from Lissel et al. That was done in 1962. And for the permanent teeth from Haviku in 1970. So this is a reference, but I don't recommend using tooth eruption or emergence for age estimation only, because can be variable and not accurate enough. But the tables are there for reference. So the other technique for using teeth for age estimation is the radiographic method, where radiographs can provide the gross stage of dental development of the dentition. It gives us the internal details of the teeth, and we can assess the stages of each tooth. Dental age estimation methods in children can be divided into different categories depending on the approach. It can be direct comparison, like in an atlas method, or it can be a dental developmental staging or a scoring system, like in the Mergian, Camerares, or Maurice Fanning and Hunt, etc. I'm going to focus about the atlas technique. The atlas techniques are based on morphologically different stages of mineralization of all teeth put together. So we're looking at the combination of stages happening at the same time, and that can give us an age estimation. One of the earliest atlas techniques was the Shore and Massler, published in 1941. It was the benchmark for in all textbooks for almost 70 years. And but when I went back to the original article, they didn't explain where the data came from, but they hinted that it was from Cromfield and Logan study. Cromfield and Logan study was tables of tooth developmental stages, but it was based on only 29 individuals. 20 of those 29 were younger than the age of 2. So this atlas was based a lot on guesswork, and they have missing ages and gaps between them. In 1989, Obilaker published his atlas. It was the data that he relied upon to form this atlas was from several articles that he collected. And then he chose the earliest age of each stage because he said, he quotes, that Indian Americans probably develop earlier than anyone else. So also this atlas is based on a lot of guesswork. These were okay enough for at that time, but when the tsunami happened in 2010, no, sorry, in 2004, the Southeast Asia tsunami, there were 280,000 casualties. Third of them were children. And when they started to doing the identification process, they wanted to group the victims by age, so to ease the identification process. And they wanted an easy to use method for age estimation. And my supervisor at the time, Dr. Helen Liversidge, was a known name in age estimation, and she was asked if she knows any simple, reliable method that can be used. And she said, well, I mean, the ones we have, the available ones, the Atlas ones, are not accurate enough. So she asked me, and I was at that time looking for a project to do my master's and PhD. And she said, well, why don't we develop a new method? So I said, okay, and we started to develop the new method as my master's project. So the aim was to develop a comprehensive evidence-based atlas of tooth development and eruption for primary and permanent teeth from 28 weeks in utero through to maturity. It was a retrospective cross-sectional study of known age at death skeletal remains, 176 of them, and radiographs of known age individuals. The total was 704 individuals. For the younger than the age of 2, I looked at skeletal remains of known age at death neonates and babies from 2 different collections, the Spitalfields collection and the Natural History Museum in London, and another collection in the Royal College of Surgeons of England collection. For the individuals older than 2, I use archived high-quality dental panoramic radiographs. Each chronological year had 12 males and 12 females in them. And then I did hand drawings of all the teeth and all the developmental stages, and I scanned them in the computer, finished them and colored them. There were a total of 358 hand drawings. And I went to Maurice Fanning and Hunt's stages that was published in the 60s. And when I was starting to do the my project, that was the first time that I was introduced to the forensic odontology, age estimation. This is something that I didn't do before. And I struggled a little bit with the stages to recognize what stage is this and what is the line between the stage and the other stage. So when I decided to redo the Maurice Fanning and Hunt's stages with my new drawings, but I added a written description that was useful to me when I was doing the research. So I did this for the teeth, and I also did developmental stages of alveolar eruption. The black line is the alveolar bone. So I looked at all the radiographs and all the skeletal remains of all the 704 individuals, and I staged all the teeth individually, and I put them into tables. So this is an example of the table for each individual. A, B, C, D, and E are the deciduous teeth. 1 through 8 are permanent teeth. And I put a tooth stage and tooth eruption stage for the upper and lower. And then, like if we take a 5-year-old as an example, at this stage, all deciduous teeth have reached maturity. The lower central incisor is starting to resorb at that age. The first permanent molars are starting to erupt through the alveolar bone. And the rest of the permanent teeth are within the alveolar bone in various developmental stages. So I did this for 5-year-olds, 12 males and 12 females, and then I took the median stage of all those children to develop a diagram that represents that age group. And I did this for all age categories without overlap or missing ages. So a 4.5-year-old child means that these children were between the ages of 4.0 to 4.99. And then 5-year-old category is from 5.0 to 5.99 and so on. And to compare with the Shuren Master Atlas, I spaced the teeth so that it will be easier to identify the stage, because the position of the tooth in the alveolar level is not important, but the recognizing the stage is important. Also, I used the radiographic representation of the teeth because the internal details of the teeth are crucial to identify the stage. And I put different colors for permanent and deciduous teeth. And then I designed the London Atlas. Starting from the arrow, these 3 first diagrams represent the monthly development of the last trimester of pregnancy. Each one of them is midpoint. There is one at full gestation birth at 40 weeks. Can you hear me? Hello, can you hear me?
Hello, hello. Yes.
Yeah, okay, because I got a message that I have poor connection. I was afraid I was cut off.
Okay.
And then the first year of life is represented by 4 diagrams. Each one is midpoint of 3 months. And the reason for this is the fast rate of development at this age group. So there's lots of changes that it necessitated the presence of more than one diagram to represent that each age group. But from age 1 onwards, only one diagram was enough to represent that age group. So these are the median stages for each tooth in that age category for 12 males and 12 females. And it goes up to the age of 15, where all permanent teeth have reached maturity, except for the 3rd molar, where I put it on the side up to the age of 23, where it reaches maturity. It has been translated into more than 22 different languages, including Indonesian, of course. It's available online for free in all the languages. And this is the one in Indonesia. And then we took things forward by developing a software, which is also available online for free. You have to use it on the website. You cannot download it, but it has 3 different modes. The first mode is the playback mode, where you can choose the age from the list on the side, and then it shows you the tooth development for that age. If you're interested in one tooth or several teeth, you can just highlight the tooth that you want by just clicking on the teeth and follow its development. The second mode is the data entry mode, or the age estimator mode. It asks you to, from the options here at the bottom, to choose from these options, and then you click, and then you create a table. You choose your notation system, depending on what you're used to. And then it will give you a table. These are the teeth. This is for, these 2 rows are for dental development. These 2 rows are for eruption. You can see them here. And then if you click on any cell, any tooth, it will give you the developmental stages, and then you choose what is more relevant to the radiograph that you have in hand. So you look at the radiograph, you look at the tooth. This is the first molar, and then you click on the developmental stages that you see in the radiograph, and it will give you an age estimation here. The more information you put, the better the results you get, because sometimes you can get more than one result. And if you get more than one result, then you click here the view diagram, and it will show you the diagram, and then you can compare that with the radiograph you have at hand. The third mode is a comparison mode, where you can compare between 2 different age groups. You can link the 2 diagrams and then go forward or backwards. Or you can compare between males and females of the same age group by clicking or choosing the gender or the sex on top. And then also you can link them and go forward and backward and look at the differences, because there are subtle differences, but they're not statistically significant. But the information is there if you need it. So the key part of doing any age assessment is to identify the correct tooth stage, tooth developmental stage. And these are the example of the tooth developmental stages with the written description and relevant radiographic representation with them. But sometimes, like here, when we say root half or root quarter, what quarter of what or half of what? One of my friends once asked me, how do you know when your child is half grown? How do you know when the root is half developed? We don't know the full potential length of that root to say it is root half. And to me,
I'm sorry, Dr. Sakher. We can
an
hear you.
opening question, because
Okay.
what is the yes? Can you hear me now?
Yes, we can.
Okay.
Thank
so
you.
when did you lose me?
Minutes ago. It's okay, but it's okay right now.
From this slide or before?
No, after this slide.
Okay.
Yes.
Yes, so one of my friends had asked me, how do we know when the child is half grown? Because we don't know the full potential length of that child to see he's halfway there, and the root. So why do we say root half? And to me, that question was an eye opener, because in my mind, we're not saying that it is half of what it would be, but we assess the amount that was developed. And to him, it was a little bit of a difficult concept to put his head around it. So I decided to make it even easier by explaining exactly what are the stages. So the developmental stages, although based on the ideal tooth form, I made them refer to the amount of tooth developed rather than its relation to the undeveloped part, which is the unknown part. And the tooth is in the stage where it has begun that stage until there is any element from the next developmental stage present. So I'm going to take you through them stage by stage with the definition. So the first stage is the initial cusp formation, TI. In that stage, the developed enamel is minute. In anterior teeth, only the incisal edge can be seen as a straight line, which is incomplete. There is no edges, just a small line. And in posterior teeth, it is isolated cusp tips that can be seen as small triangles with gaps in between. The second stage is the coalescence of these cusps. The amount of enamel visible is very little. It looks like a thin band or a thin ring. In anterior teeth, the incisal edge will start to have mesial and distal angles. And in posterior teeth, the cusps are connected, but with a gap in the middle, like a ring. It looks like a ring. Second stage is the cusp outline completed stage. In this stage, the amount of enamel visible is thick and continuous, but there is no dentin because it hasn't formed yet. The outline of the incisal or occlusal surface is complete and clear. And then the crown half is when part of the dentin can be seen, but the amount of dentin is minimal. It's a very thin band. You can see it here, different shade from the enamel, a bit darker shade of enamel. And there is no evidence of any pulp at this stage still. We say it's crown 3/4 when a substantial amount of dentin is seen. The pulp chamber can be seen, started to have a pulp area here. The pulp proof outline is straight, not defined, and the crown edges are divergent, so they're going outside a little bit. We say the crown is complete when the outline of the whole crown is visible. The pulp roof is well defined. It's a closed umbrella in anterior teeth, and in the posterior teeth, we have the convexity in the middle here. It looks like an open umbrella. And the edges of the crown are convergent, starting to close up, going towards each other. The first stage of root formation is the initial root formation. It's when the outline of the whole crown is complete, so it looks like the crown complete stage, but with added divergent spicules of the root outline extending from the cervical crown edges that have just begun to form. Very small spicules at the edges here that goes outside from the crown, goes outwards. We say that the root is quarter when we have part of the root equivalent to up to half the crown of height of the crown, and from the measured from the highest cusp to the segmental enamel junction is developed. In posterior teeth, the first sign of the furcation area is visible. Here you can see it like a small dot, and there is a little bit of dentin from the cement to enamel junction. There is a little bit of dentin. And root edges are divergent because the dentin thickness of the root walls gets thinner towards the root's end, making the pulp wider, thus giving the illusion that the apical root walls are going outwards. We say it's stage root half when the amount of roots developed is the same height as the crown height, measured from the highest cusp tip to the cement to enamel junction. So measuring from the cement to enamel junction here up to the highest cusp tip, this has to be equal to this from the cement to enamel junction up to the root tip. If they are equal or more, then it's crown half. The edges are divergent, the root edges are divergent going outwards. And then from this stage onwards, from root 3/4 up to the end of the root development, the length of the roots can be the same. Only detail is at the root apex. So when you measure from the highest cusp tip to the cement enamel junction, and you find that the root length is more, then you immediately go and check the apical area, because now it is 3/4, root 3/4 or more. So root 3/4 is when the length of the root is more than the crown, and the root edges are divergent. An easy way to remember is Elvis's trousers. And the stage after that, the root complete, is when the whole outline of the root crown is complete, the root edges are parallel. So it could be the same length as the one before the stage, the root 3/4, but the only difference is that the root edges are parallel. And then the stage apex half closed is when the outline of the whole tooth is complete, the root edges are convergent. It looks like a bullet shaped, but the periodontal ligament space is wide at the apical area. It looks like there is an abscess a little bit, if you can see it here. That's the difference. And then we say that the tooth have reached maturity, or the apex is complete, is when the outline of the whole tooth is complete, root edges are convergent, like a bullet shape, uniform periodontal ligament space around the whole root. So I'm gonna show you how I do age estimation using the London Atlas. If we have several cases and we need to do them quickly to group them, Then when I look at the radiograph, the first thing I do is to identify the midline, and then I count the teeth, just to make sure that there is no missing teeth or there is no supernumerary teeth, so that I know exactly what I'm looking at. Usually I take the right side of the individual. If there is one tooth or teeth that are not visible in this side, I can use the tooth from the other side. But if possible, stick to one side. There are some rules when you do the age estimate, when you assess the stages of the teeth. If you don't see the tooth properly, don't use it at all. If the tooth was cut off, like the edge of it a little bit not visible in the radiograph, don't use it. Use only the teeth that you can clearly identify and you can see the details of. Sometimes in areas where it is there is some overlaps or not clear, like these areas, there is problems with the radiograph. Start from the most visible area of the tooth and then follow the outline. And sometimes you can see beyond the overlap or if the radiograph was not clear enough. So start from the most visible and then go through the end of the root or of the crown. If you do that and you use magnifying glass, if you cannot still see the details, then don't use that tooth. And there are two ways of doing the age assessment using the London Atlas. You can either stage the teeth one by one and then enter them into the software, or you can compare the radiograph immediately with the atlas and then get an age estimation. I don't recommend using the direct comparison in the beginning unless you are trained enough, your eye is trained enough, because sometimes the eye plays tricks on us if it's not something that you do on a regular basis. Because in cases like this tooth here, the lower premolar or the canine, if you don't measure from the cemental enamel junction up to the crown, this can be misled to be crown root half, but in fact, when you measure it, it shows that this length is less than the length of the crown, so it is the root quarter. So I would recommend that you stage the teeth individually, and then with time, when your eye gets trained to identify the stages, you go on and do the direct comparison with the diagram. And one more thing, when you do when age assessment is part of your job, I would highly recommend you calibrate yourself. So you make sure that you do some cases, and then a couple of weeks later, you redo the same cases and compare your results, so that you know that you are at least consistent with yourself. You are you're seeing the same thing over and over. This is number one. Number two is that you calibrate yourself with a senior colleague, so you can make sure that you are seeing what you're supposed to be seeing. This is very important. I cannot stress that enough. Calibrate yourself with yourself and calibrate yourself with a colleague. Always do use more than one method of age estimation when it is for legal purposes, and by two different people doing them separately. So in this instance, for instance, this case, I focus on one side. We identify the midline and then we count the teeth. Then we identify this is cusp coalescence. It has a thin band. It looks like a ring. This is root quarter because we have here the furcation area visible. There is a little bit of dentin. This is the cement to enamel junction here. And then this bit is part of the root. The first molar is root complete. You can see that it is parallel edges. If you follow the internal wall of the pulp of the dentin from both sides, you can see here that it is parallel ends. It's open. It's higher than the length of the crown, the length of the root, and it's parallel. So it's root complete. For the second premolar, we have dentin, so we measure from the cement to enamel junction up to the highest bit of the crown, and then we compare that to the height of the root from the cement to enamel junction up to the tip, and this is less than this, so it is root quarter. Same for the first premolar from the cement to enamel junction up to the highest cusp tip, and from here to the lowest tip of the root quarter again, and so on. And this is for the incisors. We measure from here, cement to enamel junction, up to the highest incisal edge. And from here to here, it's more. So the length of the root is more than the crown. So we immediately go to the periapical area. It is divergent, going outwards. So it is root 3/4. So if we put that all into the, and we do the same for the upper teeth, I won't concern myself with the resorption of deciduous teeth. If we have permanent teeth in development, you focus on the permanent teeth. You don't have to put the information also for the deciduous teeth. And then it gives you an age estimation when you put it on the software, and then you compare what you see in the diagram in the atlas with your radiograph. We have to remember that this picture or the diagram of the atlas is the median stage of each tooth of 12 individuals. So it won't be exactly like the radiograph because first of all, this can be anywhere between 9 and 9.99. And people fall under the normal distribution of development. So you would have early developers and you would have late developers. 95% of them would fall within this curve of development. So you expect variation, but most of the teeth resemble the radiograph. I'll give you another example of case of deciduous teeth. This is all deciduous teeth. So this is a neonate. The same principle. Identify the midline and then count the teeth that we have. Here we have isolated cusp tips of the first permanent molar. Here we have a thin band of enamel. We don't have any dentin visible. This is the second deciduous molar, and this is the first deciduous molar. The same. We have the outline of the cusp tips or the occlusal surface visible. Thin enamel, no dentin. Same for the canine, for the lateral, and the central. In the centrals here, we have a visible pulp area. The edges of the crown are divergent, going inwards. We have the full shape of the crown, so this is crown complete. This is crown occlusal, crown occlusal, and so on. So you identify all the stages, and when you put them into the software or you compare them, then it will show um, the diagram of that age group. This is a person or an individual between the ages of between birth and 3 months of age, because this is the midpoint of those 3 months. So it can be 1.8 months, 1.5 months plus minus uh, 6 weeks. I wrote age estimation chapters in the forensic odontology book, which is a book on an essential guide on forensic odontology in general. But I highly recommend this age estimation and multidisciplinary approach book. I wrote the chapter on age estimation of children, but that book has all different techniques and methods for age estimation using bones, using biological, histological, and for adults and children, it's a very, very important reference for age estimation if it is what you do in your work. It is edited by my friend, Joe Atzeres Garriga. It's a wonderful book, I highly recommend it. I also wrote a chapter on the ethical approaches to human remains, which is not necessarily about age estimation, but about the ethical approaches to human remains when dealing with people from different religious and cultural backgrounds. So my chapter was on the Middle East. So I talked about the Islam, Christianity, and Judaism in the Middle East, and how um, ethics play a role when dealing with the human remains, and what is accepted, what is not accepted. So it is the first reference on managing people from those faiths in the Middle East. So if anyone is interested, I highly recommend this book. The book also deals with different cultures and different areas of the world, but my chapter was on the Middle East. Thank you very much for listening, and I'm open to any questions.
Okay, thank you very much, Dr. Sakher. We already have a few questions. The first question, in your opinion, can dental age estimation be more developed in the future?
I think with the advancements of technology regarding the use of MRI or non-ionizing radiation, it can give us maybe a little bit more accuracy. The problem with age estimation or assessing chronological age from biological age is that humans lie under this curve of normal distribution development. So even siblings within the same family, two brothers or two sisters, would have different timings of tooth development and tooth eruption. And this is, we cannot predict that, and we cannot control for that. So you always have, when you do age assessment or do age estimation, it always has to be a range. How can we minimize this range is maybe by making any method more objective, because so far the methods are subjective. It relies on someone's eye to do the or to give the answer. So I think with the technologies that are emergence, with the especially the MRI, because the MRI you can do it on many people without the risk, because radiographs are intrusive and are dangerous. So it has limitations. And the limitation with the MRI is that it is not accurate enough to assess the teeth. It is very good for soft tissues, but not for hard tissues. But now with the technology, it's getting more and more better in it. So I think so coupling that, having a way to look into the internal structures of the teeth better without risks, and using computers, using artificial intelligence so that the computer is making the decision. These two together, I think it will give us a better results, but it will definitely be a range. It will never be a date of birth. We cannot reach a date of birth. Yes, I think, and I don't think we will ever do that. But the age range might get a little bit narrower. But at the same time, there are also outliers in development. It is at least 5% of the population lies outside of that normal distribution. And it is something important to remember when we're doing age assessment, especially in cutoff ages, like an age for an age responsibility, where it's above or below that age, or the age of going to prison or not, because age of criminal responsibility is different than when you try a child as a juvenile and you put them into rehab or social services or prison. And between an adult and a minor, between below and over 18, these crucial cutoff points of age is very important to remember that we are humans, we are different, biological differences exist, and your answer has to be for the best interest of that individual, where the best interest can be either above or below that threshold or that cutoff point, if it is within the age range that the method provides.
Okay, Dr. Sakher. The next question is, in case of impacted third molar, is the use of London Atlas still relevant?
The impaction of teeth or not erupting has no effect on dental development. So teeth, as I said, it's like a clock. When it starts to develop, it takes the same time to go and finish development. That is why it is robust. That is why it is a good system to use, the dental development, because it is it's not affected by anything else, any external factors. And impaction has no effect on dental development. So the third molar would continue to develop as normal within the alveolar bone, and it will reach maturity, and it has no effect on the timing of development. So if you can see the developmental stage of that tooth, then yes, you can use it. Having said that, though, if you're, it depends on the question of the age estimation question. I was asked to develop the age estimation reports in Saudi Arabia for the Ministry of Health. And I asked them, well, what do you need them for? And they said, well, what do you mean? And I said, well, it depends. The answer depends on the question. Is your question, is this person minor or adult? The answer or the technique that I have to use to answer that question is different from, I need to get an estimation for this person so that I can give them documents. Because when I started working in the age estimation clinic in Saudi Arabia, I was shocked by the amount of children that come who are unregistered at birth. And now it's time to go to school and they need a birth certificate. So they have to go to the the age estimation clinic to have their age assessed, to give them a birth certificate. And so the answer for that question requires the use of different methods. And the answer, and I had some cases that comes from the court that wants to know if this person is an adult or not, because they have to be tried as such, because they killed someone or they were involved in a gang or whatever. And the answer for that is different. The age estimation technique is not suitable to answer the question, is this person adult or a minor? Because that is problematic when using the third molars. using third molars only in that age group between 15 and above 18 is problematic because the third molar has a wide age range and it's the most variable tooth in the human body. So when I give age estimation of 18 years, for instance, my age range around that age is plus minus 3 years, which is useless to the court, because what I'm basically saying is that this person is anywhere between 15 and 21. And this is a useless answer. What they need is the probability of that person being over the age of 18. So if the question from the court is this person adult or not, I have to use a method that gives me the probability of that individual being over or under 18. And for that, I would recommend using the Camerari's third molar index, because it is one of the most accurate methods to give the probability of the person being an adult or not. If the question was just to get papers, like a birth certificate or whatever, and it's not for legal purpose, criminal purposes or asylum, then yes, using the London Atlas or using any staging system is fine, because what you're saying is that this person falls within this age range, and then there's no ramification for your decision. So using the London Atlas to answer if the person is adult or not is not suitable. I wouldn't recommend it. I hope this answers the question.
Yes, it is. So the next question is from Prof. Mika. Is there any effect of mixed marriage in the study of dental age estimation?
That's a very good question, because when I developed the atlas, it was developed on mixed white British and Bangladeshi individuals. And then in my PhD, I tested it on 1,500 different people, but from the same population. And it was accurate. And then some studies has been done using the London Atlas on different populations. So it was done on, not by myself. I did a couple of them, but the other ones were done by different people. So it was tested on Saudi population twice, and it was Iranian, American Hispanics, American whites and blacks, South African whites and blacks, and Indonesian, New Zealand, Australian, and the results are very similar to each other. So I don't think there is no evidence that racial differences or race plays a role in dental development. I think the differences that we see, which are not statistically significant differences between races, I think these differences are back to the biological differences rather than racial. So we are all the same, basically, in regard to teeth. Whereas in bones, no, there is a big difference between race. There's lots of racial differences. But teeth, I wouldn't put race in the equation at all, because we're very similar. The evidence says we're very similar.
Okay. And the next question is, how do estimate the someone age if he or she has agenesis for several teeth?
They're missing teeth.
Yes.
You mean? This is one of the challenges, because we don't know the effect of a tooth being missing on the other teeth. We need that type of research. I'm starting a research on looking into the effect of a missing premolar on the second premolar. Does it make it develop faster or slower? But this information we don't have yet. All the tests, all the methods are based on normal individuals, healthy individuals. In the past couple of years, there are very few research that was done on children with syndromes. They test the atlas on children with syndromes, and it gave the same accuracy as with healthy individuals. There was a study on children who went through chemotherapy when they were younger to see if it had any effect on dental development, and there wasn't. But it's very, very few studies that test that test the variables of either missing teeth. So several missing teeth that says there is a syndrome. So depending on that syndrome, how it affects development, we don't know yet. The answer is we don't know yet. But it has to be mentioned in the report, the age estimation report. I did a study last year on the age estimation reports from around the world to see what people are doing, what are they writing, what information is included in the report. And I was shocked because there is no standard for writing the age estimation report, although it was published by the Age Estimation Committee in Germany for a guideline of how to write a dental age estimation report, but no one was following it. And one of the things that the most missing information is the health, general health of that individual. Did they have a disease? Do they have a syndrome? And it is a missing information. So I think having that written in the report is important, and having the research to see the effect of a syndrome or the effect of a single missing tooth on the rest of the teeth is important. We don't have the evidence yet. But you use, as I said, you use what you see in the radiograph when you do age estimation.
Okay, Dr. Sakher. It seems like it is the last question. Are there any inclusion and exclusion criteria in using London Atlas?
As in testing it or in using it for age estimation?
For age estimation.
I wouldn't say anything, no, but if it's, I would be reserved to use it for third molars only. I don't think it's accurate for that tooth. The reason is the diagrams for the third molars are the median stage of 12 individuals, okay? And the third molar is so variable that it's 4 or 5 years different between people. When do they start to develop the third molar? So using only the third molar, using the London Atlas to assess only the third molar, it won't give you an accurate result. So I would reserve using it for the third molars. It's best used for under than 15, I would say, honestly. Other than that, then you can use either. And there is the published atlas, the green teeth are for the mixed sex, so it's 12 males, 12 females. But if you want sex-specific information, you can find it in the software online. So you can choose the sex and then you can see the development. So I provided the diagrams. The reason I didn't publish the sex-specific atlas because the differences are not statistically significant. Yes, there are some differences, but they're not statistically significant. But if you want them, if you want to make sure or you want to feel more comfortable using a sex-specific diagram, then it is available online. Other than that, then so far, as I said, there was a study from Italy that proved that when it was tested on children with syndromes, it wasn't. It gave the same results as healthy, and the one in the U.S. that is under publication now. I don't think it's published yet, but it is in the publication process. Shows that on even the children on chemotherapy didn't affect the development. So I would say use it for children very confidently.
Okay. Thank you very much, Dr. Sakher. By the way, we have more than 500 participants in this webinar.
I'm honored. Thank you.
Yeah, thank you very much. Looks like we answered all your questions. So for the participants, Dr. Sakher, is there anything else you would like to mention?
I would emphasize that you have to calibrate yourself. You have to make sure that you're seeing what you're seeing all the time, be consistent with yourself, and that you calibrate yourself with someone else. Always do it in pairs, never alone, especially for legal purposes. And you, you and your partner do it separately, and then you reach the conclusion at the end. Um, because and when you're writing the age estimation report, I'm not sure how it is in Indonesia regarding do you have a standard form? If you don't have a standard form, I would recommend looking into. I published a paper last year regarding the age estimation report. So in it, and there's the guidelines by the age estimation group in Germany as well. They have the guidelines. So if it's part of your job, then I would recommend highly that you look into these things and use more than one method.
Okay.
And use the methods that you are most comfortable of. So you need to know your method. You need to go back to the original article and read it, understand it, so that you are comfortable that you are applying it the way it should be applied. I think this is very important.
Okay. Great. Thank
And
you
if you
very
have
much.
any more questions, these are my emails. Please
Okay.
email me whenever, and I'll be happy to answer any of your questions.